Welcome everyone to today's webinar. I am Morgan Hafner with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Damon Auer is a 20-year technology and consulting services executive specializing in helping health and life sciences organizations achieve business performance improvements. As Vice President of TriBridge Health and Life Sciences Practice, he oversees projects ranging from cloud-based care coordination and electronic medical records systems implementations to process and systems integration consulting for healthcare delivery, pharmaceutical, and medical device organizations. Dr. Simon Koss is Chief Medical Officer at Microsoft. In his key executive role, Dr. Koss is responsible for providing clinical guidance, thought leadership, vision, and strategy for Microsoft technologies and solutions in the health and healthcare industries. He works with industry partners and healthcare organizations around the world to improve and transform health outcomes by leveraging technology and innovation. Dr. Koss, I'll now turn the floor over to you.
Thank you, Morgan, for that great introduction, and welcome everyone to today's webinar on mastering personalised care, which is a change in health. Damon, if we can move to the next slide, let's talk a little bit about change. This is one of my favourite quotes. It comes from the 1820s, and this is how they used to talk. That it will ever come into general use, notwithstanding its value, I am extremely doubtful, because its beneficial application requires much time and gives a good deal of trouble both to the patient and the practitioner, and because its whole hue and character is foreign and opposed to all our habits and associations. What was John Forbes talking about in the 1820s? The stethoscope. Isn't it ironic that such a quintessential symbol of healthcare today was viewed at one time with extreme skepticism by the medical community? And if we could jump to the next slide, Damon. In fact, we've now moved into an entirely new era where technology is all around us. They're no longer big, bulky desktop PCs. Technology is now invisible, it's ubiquitous, and it's active. It's collecting information and then feeding it back to us in ways that we can take and use, which is really exciting. But if this is our modern consumer experience, the challenge is how do we translate this into our models of healthcare so that we can deliver that personalised service experience in context of our health care? What does better health look like? On to the next one. Some people would say that better healthcare is the triple aim of better quality patient experience, better access for populations so that we can manage wellness, and then doing it at a lower price point, at a lower cost to the health system. And that's the triple aim that many people know and resonates with. It's over 10 years old now though, and I think there's a missing piece. Next animation. There was a paper in 2012 from Bodenheimer and Sinsky that talks about the quadruple aim. And I love the title of this paper, From Triple to Quadruple Aim, Care of the Patient Requires Care of the Provider. I think this is a missing element. If we really want better outcomes for our patients and to manage populations effectively, and in doing so lower the per capita cost of care and our health expenditure, we need our clinical care teams to have the very best tools and equipment to be able to provide that seamless experience. So moving on to the next phase, I think about how do we empower care teams, engage patients, use analytics so that we can manage those populations, and then use new technology so that we can lower that per capita cost of care. On to the next slide. I'll illustrate that in a simple 4-box model. This is, I think, the essence of digital transformation in health. It's a journey that we're all on, and we're all at different stages. If we look within the care facility, right now, there are a lot of investment in systems of record, those electronic medical records or clinical information systems. But there's a range of other technologies that care providers need to provide that very, very best care, from richer communications through to the systems of insight that actually use the data that's collected in those systems so that we can drive performance in care. If we've got a digital continuum within our 4 walls and we truly empower our care teams, we can extend out to engage our patients and other partners that we need to provide that holistic and seamless continuum of care, be they payers or government regulatory agencies, administrative bodies, or academic and research organisations. With a digital continuum across both our own care facility and our digital affiliates, we now have an asset that we can unlock through health analytics. We can take that information, we can structure it, store it, and use it. We can even mash it up with new evidence sources, be they socio-demographic data or weather data if we're doing population health mapping, or other newer types of information like genomic data sets if we want to usher in an age that will truly transform the care continuum with precision medicine. And I think that's the challenge. How do we not just use technology to do what we've always done, but use technology to provide an entirely different model of care and service experience? So that's the challenge. What does digital transformation in health look like? What does your journey look like? It's my absolute pleasure to be here and participate in the TriBridge Health 360 webinar, because here's a solution that does just that. Damon?
Thank you, Simon. Appreciate that intro and the point of view on technology and its transformative impact in healthcare. I showed my 12-year-old son the quote from your slide, your opening slide, about the stethoscope last night as an example of a disruptive technology in the 1800s, and he didn't get it. It took, I think I had to explain it 3 times because he couldn't grasp the concept of the resistance to new technology. But I guess that's what transformative tech looks like in retrospect. Hello, everyone, and thanks for spending the next 40 or so minutes with us. As Dr. Koss mentioned, and Morgan did a solid intro for me. Thanks, Morgan. My name is Damon, and I lead the healthcare practice at TriBridge. One of the things that is really cool and rewarding about my job is getting to see how our own healthcare customers are innovating using technology solutions like Health 360 and the Microsoft Cloud to change the lives and the well-being of the people that they serve. When we conceived Health 360, it was grounded in the idea that healthcare organizations need to find ways to serve consumers, also known as patients, better, more proactively and more personally, to achieve the goals of the triple, now quadruple aim that Simon described. It's based very much on a strong belief on our part that personalized care experiences are better care experiences for everyone involved, the patient, the provider, family members, etc. Which is why when we started to create the Health 360 solution, we didn't choose to do it from an empty hard drive. We started with the Microsoft Dynamics 365 CRM, foundation in the Microsoft cloud. And we started with CRM for a couple of really good reasons, and it's very relevant for our discussion today about how providers are digitally transforming the enterprise. First and foremost, CRM presents a person-first and person-centered data model, which is frankly a fairly new concept in healthcare organizations here in the United States, where historically we have centered data models on facilities and beds and equipment and physicians, as opposed to people, the people that we aim to serve. And it's an important distinction when you think about enabling systems for digital transformation, because we all, as people, play different roles as we make our way through life. We're all children. Some of us are parents. Some of us are siblings. We'll all be patients one day or another. And some of us are caregivers. And CRM systems, customer relationship management systems, are designed to help manage that complexity of changing roles and relationships between people. So what is Health 360? Here's the elevator pitch. In fact, this is a quote from an analyst who did some work looking at Health 360 a few months back, saying Health 360 is a CRM-powered population health solution delivered in the Microsoft cloud. Does that tell you what Health 360 is? Is it clear? Probably not, is my guess. It reminds me, it's like answering the question, yeah, but what do you do, that I used to get from family members and friends when I started my career as a consultant at Anderson Consulting. Because consultant doesn't mean much on its own without context. So what I figured out was the only way to really explain what a job like consulting is to describe the work that we're doing with specific organizations and the results that they're achieving. So similarly, I think the best way to understand what Health 360 is to tell you some of the stories about how our customers are using the system to change their organizations. We've been in the market with Health 360 for a couple of years, and have had the chance to work with a couple dozen customers at this point. And we've seen some really creative and innovative uses of technology and Health 360 in those organizations, some of which we anticipated and thought would come about as the consumerization of healthcare in the U.S. begins to take more root. But some of them we didn't anticipate or expect when we created the product, and those are interesting stories too. So I want to share some of those customer stories with you today. I think we'll have time for 4 or 5 that are all a little bit different, but you'll also see some of the similarity, I think, in the impacts and the vision of these organizations to change the way that they're engaging with patients, customers. So as I described some of the neat things that these healthcare organizations are doing with Health 360 functionality, I hope some light bulbs go off for folks in the audience. If you have questions or comments or an idea that's so bold that you just have to get it out there for the rest of the audience to see, by all means, please capture that in the question box, and we will get to them. I don't think we'll answer them in real time, just because that's difficult to do in a format like this, but we'll address as many as we can towards the end of the presentation. So with that, let's get into some cool stories. The first one I'm going to start with is remote monitoring and telehealth story, and this is absolutely one of my favorites, one of my favorite customers that we've had an opportunity to work with in the last 2 years. And this story is from Dartmouth-Hitchcock. And Dartmouth has had no shortage of healthcare transformative vision over the years, and remains a real thought leader right from the chief executive suite down through the organization in terms of how we can test changes to care models and engagement models for the benefit of patients. So we met the innovation team at Dartmouth 2 years ago, and they had a vision at that time to deliver exceptional personalized care that our patients deserve at a lower cost. But how do you do that? And this is where another innovation from Dartmouth really made a huge difference. So they had this idea for a service called Imagine Care. And to enable that service, and the vision there was that they would find a way to remotely observe and support and impact the health and well-being of chronic disease patients. And if they could do that well and use technology appropriately, scale that to be able to really impact a large population without overburdening their workforce to the point that it couldn't manage. So they created this Imagine Care service concept and hired leaders for that organization, interestingly, not from healthcare, but from other consumer service organizations. And the big difference in their approach here was putting the person at the center of the concept right from the start, and aiming to delight people in the service that they provided. So everything, the technology and the way the components were assembled there, including Health 360 and some other things I'll tell you about, all served that top level vision, is to really change care experiences, personalize and change care experiences for the people they serve. So what did we do? How did they do it? They created this service, implemented Health 360 to be the system that managed the personal care plans and preferences and everything that we could learn about the patients they served. And then act as the activity orchestrator for care navigators and nurse navigators in remote facilities to observe and then intervene on behalf of those patients before things went wrong or irrecoverably wrong. So Health 360 integrated with a number of IoT devices, including wearable activity trackers, blood pressure cuffs, weight scale for CHF, and even a wireless inhaler for COPD and asthmatic patients. And what that did is it gave the nurse navigators in Command Central an incredible depth of information about what was going on with any of these patients at any point in time, wherever they were, and gave them the opportunity to intervene when they saw trends that were things they thought they could have an impact on, a positive impact for the patient. So results that they reported are really pretty incredible and on screen here, but I'm gonna call them out anyway because I always find them really impressive. So results that the Imagine Care service reported in the first year of operation is a 36% reduction in the total cost of care for the chronic disease population that they were serving, a 23% reduction in ER utilization for that population, 4 times, and this is a big one because it really has everything to do with the success, we think, of programs like this, is the engagement, sustained engagement of the customers that we aim to serve and collaborate with for their benefit. And they showed a 4 times the national health and wellness program engagement average, which admittedly is a low starting point, but an incredible sustained engagement. And they did all of that with a 95% customer satisfaction rating. So Imagine Care is a pretty amazing story out of Dartmouth. It is launching as a service in Europe this year as well, starting in Sweden, and is an organization that we continue to work with and are excited about. So a question for the audience is your healthcare organization using connected devices to remotely monitor patients?
Awesome, and we have that poll launching now. So if our audience can please select one of the 3 actions to let us know, we'll just give it a few moments here to get as many answers as possible in. Awesome. Thank you, everyone, for your responses. I'm going to go ahead and close the poll. Awesome. And it looks like for our results, we have 34% said yes, 52% replied no, and 14% are saying they plan to use it in the future. Awesome. I'll pass it back over to you, Damon.
Cool. Thank you for that. The next story that I'm going to share is from another customer that's doing some really innovative stuff to impact health and well-being. And this is AIR Healthcare Solutions. AIR is the most modern version of assistance in recovery that grew out of a 20-year behavioral health counseling business called Assistance in Recovery that has taken that time to refine behavioral health protocols that have an incredible and differentiating impact on the people that they serve. So what AIR set out to do, their objective is to scale that capability beyond the care team and provider professionals that have provided the service in the past, but scale it nationally and find a way to enable their workforce and care team members to really operate with consistency from a care plan, because they know evidence-based tells them that if they follow that protocol in those steps, they will have the best outcome for their patient. So they have been looking for ways to scale that business and have gone about implementing Health 360 now, integrated with a proprietary claims analysis system attached in the Microsoft cloud with algorithms that they also have refined over these 20 years to observe claims data and predict and discover people in the population that have an undiagnosed behavioral health condition where they can have an impact on that person's well-being. So they've implemented Health 360 alongside for the personalized care plan. The claims data analyzer gives us a prediction of who's going to benefit the most from an intervention and support by way of an undiagnosed need. And then they're able, care teams at AIR Healthcare, are able to act on that information to personalize care plans, outreach, and support for that person. It kind of reminds me, it's like the pre-tags from that Philip K. Dick story, but they're aiming to help a patient rather than prevent a crime in this particular case. So the results that they've reported are, again, really impressive. 80% of their substance abuse patients remain abstinent at 12 months, which is considerably higher than the national average. And the big one here is a 46% reduction in 12 months claims cost for the patients that they're serving. They've enabled personalized care programs. They have real-time information on client recovery, who's doing well and who can benefit from more support. They've achieved scalability on the Microsoft cloud to reach new populations and have just incredible insight into the health and well-being and needs of the population they're serving via the analytics associated with it. So another really cool story, and this is really the future, and we're seeing this from more and more of our customers and healthcare organizations out in the market, is that we need to create care plans, to personalize care plans effectively for an individual. We need to incorporate medical and behavioral and preferential and social information about that person into a care plan that is uniquely theirs. Dr. Koss mentioned the term precision medicine. And precision medicine tends to imply a custom biologic or pharmaceutical or device that we've developed specifically for a person to change the trajectory of their illness. But there's also precision care. And that just means that we're paying attention and we're personalizing every interaction that we have with individuals from the healthcare organization. We can do that now. And we can do it with mass customization at scale on a CRM platform and leveraging a solution like Health 360. So really cool impact story out of AIR. Next, and this is very different, but really goes to the fourth quadrant of the quadruple aim, and really changing provider experience with our health system. So this is for some reason I'm getting weird screen, okay. This is a large rehab hospital operator, maybe the largest in the US, but they operate inpatient long-term acute rehab facilities all over the country. And their aim several years ago, it was to improve the relationships that they were able to proactively create and manage and influence with referring providers. And to do that, they selected Microsoft Dynamics CRM and TriBridge and leveraged functionality from the Health 360 Care Network module to provide functionality to rehab liaisons who are out in the field calling on those providers that are referring into the rehab system to ensure that those providers' needs and concerns are met and that they're communicating effectively, and also are capturing the referrals that they can have the biggest impact on those people who are going to benefit the most from a referral into their rehab org. So they've implemented CRM, and they've got more than 1,500 rehab liaisons that are using the solution on mobile devices to pre-plan their visits to providers and make sure that the relationships and the referrals are good and that they're doing the best that they can to make it a good experience for that provider to work with them and their patients as a rehab organization. So they've seen an increase in referral quality, a really interesting outcome, which they didn't aim for, but ends up being a delightful unintended consequence of the work that they've done to improve the relationships with the providers, is that they've also improved the patient experience, particularly as they transition from the care of their physician to a rehab program and then discharge from that program back to the physician. The fact that the whole organization is now paying more attention to that process has led to a patient satisfaction and outcome benefit that was not originally targeted by the initiative, but has been a really, really cool outcome. And of course, they've improved provider satisfaction along the way. So right on track to impact all of the elements of the quadruple aim in that scenario. The next one I want to talk about is maybe a more common or easier to understand. At least there's many hundreds of these ACO organizations now in operation around the country, but this was an early one. Out of Virtua. Virtua is a multi-hospital system in southern New Jersey, outside Philadelphia. And Virtua launched a Medicare shared savings ACO in 2014. And so they were one of our very earliest care coordination customers. And really were paving a new path in early ACO operation. And Al Campanella was their EVP strategy and really the visionary, the process and systems visionary behind what they did to prepare to support the new care coordinator organization that they were creating to impact the lives of the 32,000 people that were attributed to the ACO at launch. And Al said it really well in his words. He said, the goal is we have to have a system that listens to the data and creates alerts and coordinates care activity for our remote care team members. We have to know who our patients are, and then we have to be proactive about coordinating their care. And he knew right off the bat that that would mean new systems of care coordination for Virtua. So Virtua selected Dynamic CRM and TriBridge and the TriBridge Care Coordination solution to realize that vision, and integrated the solution with multiple clinical and practice management, rev cycle, and their HIE to listen to the data and create alerts for care team members to intervene or take action on behalf of the patient and the population. They've been running that ACO now on these systems for several years, and so end up being a great reference case for what you can do with proactive care coordination processes and people and infrastructure. They've reported measurable gains in patient satisfaction, clinical outcomes, improvement in health utilization, and a reduction in overall health claims for that population. And from a workforce productivity and provider satisfaction standpoint, report that they're enabling their population managers, care coordinators, and physicians to better manage patient relationships and coordinate care for the individuals in the ACO. So very, very cool, forward-looking initiative on Virtua's part almost 4 years ago at this point. Okay, the last story, and a pretty different story from the four that I just shared with you, is the patient golden record idea. And this is work and a solution that we created with a large hospital system, 20 plus hospitals anchored in an academic medical center, and an organization that also runs a very successful and good size now health plan with almost 6 million patients and members served. So they had an objective, and this goes back about 1.5 years at this point, but they had an objective to make it a whole lot easier for their patient access staff and member services staff to understand their patients in a more complete way without having to navigate to dozens of systems. And as I think many in the audience will appreciate, and we'll do a quick poll, not quite yet, but here in a minute, there's valuable patient information scattered all over a large healthcare enterprise. And that makes it extraordinarily difficult, despite our best intention, to deliver a personalized care experience to our patients when they need help, whether they reach out to us or we reach out to them. Without having a complete view of that patient and what's going on with them and the interactions that we've had with them as a health system, it makes that a nearly impossible job to do. So the objective here in this organization was to make that easier for those patient access and member services folks to personalize those interactions, and every time they had a communication opportunity, add an element of personalization to that communication. They've implemented Health 360 Engagement Center, and I'll describe that in a few minutes. But they've implemented that to aggregate data from what are numerous electronic medical records systems in the enterprise, practice management systems, rev cycle systems, patient satisfaction, and survey systems, to aggregate them into one easy to consume visual space that is Health 360, so that their folks don't have to try and be a detective and find the data wherever it's captive in all the different systems. And they have been live with this solution for just about 6 months and have begun to report some pretty neat results. And this really speaks to the scalability and our ability to leverage technology to mass customize, which sounds like an oxymoron, but that's what customer relationship management systems have been created and tuned to do in large enterprises over the last 2 decades, to mass customize those experiences. In results they've reported, and from a scale perspective, 5.6 million patients have been loaded and are clean, and the golden record now exists in Health 360 for those patients. And they're exchanging pretty high volumes each day with these disparate systems where we either need to go and get the latest information or supply information that we moved in Health 360 back. But the volumes of message interchange are approaching, and I think north of sometimes 600,000 a day. So pretty high volume system as well. Patient preferences and activity now inform every interaction that the patient access staff or member services staff have. They now can log into one system instead of a dozen, which creates a just work satisfaction bonus for those people, but also has led to an economic bonus as they've been able to retire access licenses for the several hundred folks that are in this team to all these underlying systems, which is another advantage. So a great story. The golden record term came straight from them, not from us, but we like it, so I've included it in the storytelling on this one. So a question for the audience here. How many, in your healthcare organization, how many different IT systems store patient information in your organization?
Awesome. The poll is now launched, so our audience members, if you want to take one moment to go ahead and select one of the following, either 1 to 2, 3 to 4, 5 to 10, or 10 plus, and we'll give everyone just a few seconds here before we close the poll. All right, I will go ahead and close the poll now. And our results are showing 29% answered 1 to 2, 37% answered 3 to 4, 26% answered 5 to 10, and we had 9% that said 10 plus. And Damon, I'll go ahead and turn the floor back over to you.
Thank you for that, and thanks for the participation, folks. That's the last of the stories that I want to share today. So let's, just a few examples of how different healthcare organizations, and I hope you picked up on the fact that these are different size and intentioned providers that are using the Microsoft Cloud and Health 360 to personalize and coordinate care and really change the way that patients and providers experience the health system. So we can't really make a polling question out of this, but if I had a chance to talk with you directly, the question I would have is, what new use cases can we imagine? Because we're at such a transformative time in healthcare and healthcare IT that we're limited now almost literally just to our imagination in terms of the ways that we can change the way that patients are able to interact, the way that we are able to serve, and the way that we can personalize each experience in a way that's meaningful for those individuals and the health system. So with that, I will stop presenting and let's take some questions if they exist.
Thank you, Damon and Dr. Koss, for that fantastic presentation. We'll now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We will try to get through as many questions as we have time for. It looks like we have a lot of questions coming in, and the first one from the audience is, you've just shared a lot of different CRM stories in healthcare organizations. Where should we start?
Good question. So one thing I did not cover is the components really that make up the Health 360 solution. And the reason that the components exist is to help healthcare organizations answer that exact question of where do we start? There's so many places that you can imagine having an impact as you look across your healthcare enterprise, that can be almost a paralyzing question for some organizations. Say, my goodness, there's so much we can do. Where do we start? So short answer is that we recognize the fact that there is a broad variety of use cases and impact areas in the healthcare org, and so we've modularized the Health 360 solution to make it easier for a healthcare organization to pick a place to start. The easiest place to start, or maybe the sort of no-brainer place to start, is at the Health 360 Engagement Center core, which is the data model and the base configuration functionality for a healthcare provider to begin to be intentional about changing the way that they think about and act on patient relationships. So that's the core where anybody can start. And in fact, the golden record case example that I just shared that's exactly what they've done. They've implemented the engagement center, but haven't implemented other modules yet. Then there's other modules you'll see on the right hand of the screen here. Care coordination, which should be relatively self-explanatory, but that's where we create and manage personalized care plans and all of the activity around them. The care network management functionality that I described briefly in the large rehab hospital case, which is really the physician and provider relationship management functionality. Then there's consumer experience and consumer engagement. Consumer engagement stuff has everything to do with our ability to remotely monitor and collaborate with patients wherever they are. So functionality for those connected devices exists there. And the consumer experience is really meant to help us automate those touch points and enable those touch points wherever they happen from a contact center perspective and take some of the friction out of that. So there's a bunch of different places you can start. There's a long answer. The short answer is start with the Health 360 core engagement center functionality.
Great. Thank you for that breakdown. We have an audience member who would like to know more about how this will integrate with EHRs. If it doesn't, how are you overcoming the objections around providers having too many places to enter data already?
Yeah, absolutely great question. And frankly, a lot of the reason for CRM and a system like Health 360 to exist is that we've got information just too scattered about. So yes, we integrate with EHRs in every implementation scenario. And some of those integrations are getting easier as we have more modern versions of EHRs that have adopted HL7 FHIR standards and that messaging protocol, which we deliver out of the box. For older EHRs, there can still be a heavier integration lift to get that work done, but we've done it enough at this point and have enough assets that that we know how to do it as efficiently and economically as possible.
Great, thank you for clarifying that. We have another audience member who's asking, does this provide a template for the Medicare annual wellness visit and or CCM chronic care management?
Yes, it does.
Great. Thank you for answering that question. And another audience member is asking, have you encountered resistance by healthcare professionals to automation tools or cloud-based tools?
Good question. What's interesting is the UI, the UX, the user experience that I think we have learned to live with from most of the big incumbent EHR vendors. Tends to be, decade-old user experience stuff, and that's very different when we look at the Microsoft Cloud and the user experience in those applications and systems that we're able to deliver via Health 360. It's a much more modern, friendly, intuitive sort of user environment. So what we've actually seen is instead of pushback from care teams that are seeing Health 360 and you might expect them to go, ooh, geez, here's another system I have to muck around with in addition to my EHRs, that they're eager oftentimes to leave the EHR UX behind in favor of a far more modern and intuitive and efficient and easier to use environment. So we've actually seen that as a plus, not a negative with Health 360.
That's really interesting. Thanks. And the next question is about TriBridge Health 360. And the audience member is wondering, TriBridge Health 360, is it just focused on making life easier for the provider, thus the quadruple aim? Or are you focusing on the three aims?
Absolutely, all three, and the fourth when we add in the quadruple. In fact, Health 360 was designed right from the beginning with the idea that we are going to focus solely and completely on the patient and their experience. And in fact, we even avoid the term patient in favor of consumer in most cases. And so it's absolutely an end consumer focused system designed from the ground up that way. And so yes, we do enable better workflow and in a systems tool environment for care team members, but we absolutely are doing that to benefit the patient, their satisfaction, evidence-based protocols in the system that we can ensure are followed, help us meet outcomes objectives, and by virtue of personalizing a care plan and proacting on behalf of the individuals in our population, we are improving their satisfaction, outcomes, and by virtue of that cost. If we can do all of that while making it a more pleasant work environment for the provider, then we've checked every box on the quadruple aim.
Great, thank you for pointing that out. And the next question is a clarification question from the audience. So Health 360 pulls info from several systems to make a single record. The audience member wants to know if that's what 360 does.
Yeah, I think if I understand the question, yes. So we gather up every bit of information that exists in our systems in a healthcare enterprise and is patient specific, and gather that up to create a complete view of everything we know and can learn about that individual. That's one answer to the question. The other answer, which may be where it's targeted, is at the care plan itself. So the personalized care plan for the individual does, yes, incorporate both a medical protocol where appropriate, behavioral protocol where appropriate, and personal and preferential information. So my own personal goals and fears all factor into a care plan that stacks and rationalizes into a single care plan for that individual.
Thanks for that great question and really informative answer. Another audience member is wondering, has this ever been used to improve glycemic control for people with diabetes? And if so, how?
Yes. In fact, the Imagine Care example that I mentioned earlier, the diabetic population was one of their chronic disease cohorts. And so the results that we saw there relate to, they're not specific to that cohort, but we could get more specific information to share metric-wise. But basically, it's the same model as any remotely observable and remote intervention scenario. If we have glucose readings and we can either take those automatically from a connected device, or we can take those self-reported via a small screen app from the patient, our frequency of observation has increased dramatically. And so nurse navigators or care navigators who aren't nurses can, in fact, act on, with the right rule set, act on what we're able to observe with frequency like that. So yes, the diabetic population is almost always one of the chronic disease targets in the customers that we work with.
Thank you for clarifying that. And we've just received a ton of great questions, so I'm just going to ask another one. Is the TriBridge Health 360 a dashboard?
It includes a whole bunch of dashboards, yes. We can basically dashboard visualize any piece of data in Health 360, and that's just an inherent function of the Microsoft stack that everything runs in. The Microsoft Cloud utilities allow us to do that.
Great, thank you for answering that. And another audience member is asking, have you looked into applying this technology to the patient billing process so that patients can understand and pay their bills easier, which would be part of their financial consumer experience?
Yeah, that's a fantastic question. And actually, that's one of those light bulb things I was talking about at the beginning of the presentation, where we have talked about that and even begun to sketch out how that could work. We have not productized it yet, but it would be it's absolutely a valuable use case on the system.
Yeah, that's really interesting. Thank you. And another audience member is asking, is there a patient-facing portal? So kind of backing off that question, which I just asked.
Yes. So basically, any data in Health 360, it's all web delivered, and so we can make it available via a web property to any participant in the care continuum. So including patients, family members and friends if appropriate, community service provider tasking and coordination, which is such an important part of executing on a personalized care plan. All of that is web enabled via Health 360, yes.
Yeah, great question, and thank you. And another person is wondering, who are you selling to within the organizations? Is it the Chief Information Officer? And then in addition to that, do you start with pilots?
Yeah, so it's interesting. The executive sponsors for a solution like this 4 or 5 years ago were pretty different than they are today. And so it's been interesting for us to see the changing executive responsibility for the strategic impact that you can have with a system like this. So in the early days, and in the Virtuous story, you saw our executive sponsor there was the Chief Strategy Officer, as opposed to a technology executive, and that was pretty consistent in the early days of ACO. So it was typically an ACO executive, or a strategy executive, or an innovation executive. Today, it's very frequently a population health executive or an IT executive, as CRM has started to become a bit more understandable and understood. In healthcare organizations, it's shifting more to technology executives today. So the proportion is changing, but they come from those different places. And I think the second part of the question was pilots. Do we ever do pilots? Yes, we do pilots all the time. So that's a concept that we're comfortable with.
Great, thank you for breaking down that question. And then we have the next question from the audience is, what are the methods of training your physicians to use this technology? How long does it take to become fluent? How long does it take for physicians to become fluent in its use?
Good question. So when we think of users of Health 360, we tend to think in terms of care team members, which can be inclusive of the physician or physicians, but does not have to be. So a physician, in many of our implementation scenarios with customers, physicians have just gotten over the hump of getting productive in the EHR, and would prefer to continue to document their interactions with a patient in the EHR. Of course, we can make use of that once it's documented. So more often than not, the users of Health 360 are nurses and care navigators and folks like that, and less often physicians. But sometimes physicians, particularly where we've got an extended community network outside of the enterprise, and we want to enable those physicians to deliver part of a comprehensive care plan for a patient. So training happens right in the system. So there's training assets that are there, and so it shows you where to point your finger and your mouse and things like that right in the system. So context is there. And then, of course, there's lots and lots of pre-recorded content to assist in training as well. I don't have a good metric right in front of me right now for how long to productivity for a physician, so I'm not gonna throw an answer out on that, but would be happy to follow up if somebody wants to reach out on that one.
Thank you for clarifying that. And it looks like we have time for one more question today. An audience member is wondering, you work across many health provider organizations. Are the business challenges pretty diverse, or are there commonalities?
Both. Unfortunately, that's not a short one to answer. The short part of the answer is both. There's some things that are absolutely common. You just see again and again. The fact that valuable patient data tends to exist in lots of different places in a healthcare organization is pretty consistent. The need to make best use of the data that has been captured and will continue to be captured in the EHR is a common challenge. One of the things that we've seen, actually, this is one that is pretty common across the board, is that there's a lot of organizations that have figured out or begun to figure out the data side of this equation, the population health equation, right? So we can know at a medium level or higher medium level the cohorts in the population that we need to take care of. But then the question becomes, how do you turn that from, hey, we know we need to do something with this group of people that we've identified, into action that you can manage for the benefit of each individual in that cohort. And so that's Health 360 was built to do that, to enable that action, the population health action, once we know who our patients are. And of course, we learn a lot more about them as we're interacting with them on a perpetual personalized care coordination journey. But I'd say that's a commonality as well.
That was a great question to end on and an informative answer. So thank you for that. And that is all the time we have for today. I want to thank Damon and Dr. Koss for their excellent presentation, and to our audience for participating today. Enjoy the rest of your day, and we look forward to having you join us for future webinars.